everyone, my name is Midwife Sally. Welcome back to my channel. On this channel we'll talk about pregnancy, labor and delivery. So everything about your pregnancy and labor, we take care of that. And don't forget to like and comment, because when you comment we are definitely going to come back to respond. I'm seated here at T Havana in Tema. You can have your parties, weddings and every event you want in their gardens. Yeah, so we are continuing our conversation on circumcision. We have here our celebrity midwife. Her name is Nana Ekia. She works at the Pentecost Hospital. Welcome back.
Thank you.
Okay, so we are glad to have you back here. Yeah, so the other conversation was very insightful. If you haven't watched it, go and watch it on circumcision, the types and all that. Today we are going to talk about how to care for the circumcision, like you've done circumcision for your baby. The focus is a baby. How should the mother take care of it? Yeah, so that's the question for today.
Okay, so as we learned earlier, we have types of circumcision. So either you are doing the one with devices, the gonko or the placebo, or the manual one. Placebo is the same as the ring. It's commonly known as the ring. So this is it. So as I said earlier, the ring will be on the penis, and the hole, this hole, it will be, it will also be there for the urethra to, be very, very visible, so that the urine would pass through with no problems. Okay. So after circumcision, we give take-home instructions. So when we do circumcision for you, some people are so concerned that their babies, especially with the ring, they wouldn't be able to pass urine. So that's why I'm demonstrating that there's a hole, very visible. There's a hole. So it's just like the ring. So how my finger is passing through it, just like that. Okay. Because we will take this off, we will break it.
Okay.
We will break it. We don't leave it. Yes, we just leave this. So the penis will be inside. Okay. So we break it for you.
Wow.
Yes.
Okay.
So the urethra will be showing, so the baby will
release.
pass urine freely with no complication. So we advise that you observe the sites for bleeding. You observe to see if there's bleeding. With this, you shouldn't see the baby bleeding.
Okay.
So in a case that you see maybe it's shifted because of the pampers that we encourage them to put on the baby, you shouldn't expose the penis after circumcision. We cover up with the pampers, the diapers. So if you see that the diaper is soaked with blood, you should call the midwife or the circumcisionist who did it for you, or you should just rush to the hospital. And you also observe the site. With this, the third or the fourth day, because there's no circulation because of the string attached to it, you tie it. So when you tie it, you see the place will become very dark. So there will not be circulation of blood flowing. So it makes way for that ring to fall off.
Oh, okay.
Yeah, so you observe the site to see if it's not too swollen. Because if it swells beyond its limits, it will have problems. So that one, so you have to observe. Then you also observe that you don't see any rashes or blisters.
So it shouldn't be too swollen. There should be no rashes,
no blisters formations too. So if you notice these things, you have to call your circumcisionist or rush. You shouldn't bleed. Rush to the hospital. In case it's bleeding, all you have to do is just apply pressure with a neat napkin or handkerchief, anything you have in the house, either cotton or scarf. Just apply pressure till you reach the hospital.
What is the apply pressure? Is it how?
So assuming the penis is inside like this, so it's mostly like this, and if you see that the diaper is soaked with blood, just take off the diaper. So cover the place with a neat handkerchief or scarf. Apply pressure, press it so hard so you reach the hospital. Don't just go without applying pressure.
Should it be firm? If you're saying hard, then they'll press it and the penis
not too hard, but then reasonably. Yeah, you should press it. Because the pressure would stop the bleeding in a way. Okay. So you just apply pressure till you reach the hospital. Don't just leave it and be making calls. There's bleeding. The time you read it, maybe you don't know the amount that the baby is losing. So we advise that just apply pressure till you reach the hospital. And the care that we give is don't apply. I don't know, but in Ghanaian society, most people, the home doctors especially, they have some concoctions or some mixtures that they do. They feel when especially with the manual one, the cutting, they want the wound to heal very fast, and they apply charcoal, Pepsodent, all that. It's not advisable. The only thing you should do, especially with this ring, just apply spirits.
Okay.
So the ring will be on it like this, with the string attached it somewhere in the middle. So we always do it this way.
Oh, okay.
So the skin will be there. So when it's falling, it falls with the skin.
Wow.
So we only advise that you use spirits with cotton, your clean hands. Just be cleaning the sides.
Evening or
morning and evening is very fine. Morning and
Okay.
evening or once a day is fine. And we don't advise that you bath the baby.
But the spirit, won't it burn the baby?
No. It's just a sharp pain. Then just like the incisional sites
Okay.
of the cesarean section mothers, we use spirits to clean, to prevent
Is
infection.
that the only
and for
lotion that is used for now?
For
Only
now, we use
spirit?
spirits, and
Okay.
I advise you put dress ointment too.
Dress ointment.
Yes, you can put
So you
dress
give
ointment.
do you
Yes,
give it
it's
to
part
the
of my
mother?
package. If
Okay.
I'm doing circumcision for you, I add it to my package.
Oh, okay.
Yeah,
That's nice.
and we also try to control fever. Babies, this one is very painful. Not very painful, but then it's painful.
Okay.
So we have to give paracetamol, either suppository or the oral syrup,
Okay.
for at least 3 days.
Okay. So you mentioned that they are not supposed to bath the babies. So what do they do
You just have to
during that period?
You just have to stop and tell the baby. You just use a normal towel with warm water. Just normal towel with warm water and dab the baby. Just for 4 days or 5 days, the ring will fall off.
Oh, okay.
If it's the manual one,
So it will stay. It should fall off by 4 or 5 days.
it depends on individual skin.
So what's
the duration is from 5 to 10 days.
5 to 10
5
days.
to 10 days. At times you can get a client that the baby's ring will fall off maybe the 3rd day, because I have so many clients, babies
Okay.
falling off around the 3rd or 4th day. But mostly it's between 7-8 days.
Okay.
Yeah, the longest it should take is like 10 days or even 12 days.
Okay, and after that, how should the mother still care for the place?
You don't have to use warm water. If you use warm water, you leave a big scar. You leave a scar formation around the penis. So all you have to do is just bath the baby and don't go around that area. Leave it just like that.
Okay,
It will
very
heal
important.
completely.
They said leave it after the ring is off. Just leave it.
It will just heal completely.
Okay.
And some apply penicillin, Vaseline, a whole lot. But then it depends, as I said earlier, because some react to those creams.
Okay.
So with spirits and dress, you are good to go.
So it means that the care of it is very simple.
It's
Keep
very,
the
very
place
simple. Keep
clean
the
and
place
dry.
clean and dry, free from, scratching and touching.
Then you just clean with spirits
Spirits and
and
dress.
don't bath the baby.
Don't bath the baby until it's off.
After it falls off, you can bath the baby.
Yes.
And
Then
you
you just-
don't apply anything.
Yes, you just leave it for it
Oh,
to heal
okay.
completely.
Wow, thank you. Okay, so please, you do circumcision.
Yes, please.
Okay, so you can
That's
tell
my
them your
specialty.
location, and then we can also add your number so that if somebody wants to
Okay,
contact
so
you.
I do circumcisions both for kids and adults. We do repairs. So I work with my mom. We have a small company. So
Wow.
yeah, he leaves circumcision. So we do for kids and adults, and we do repairs too. So if you have any problem with your penis, you can contact me. My number is 0244111328, or you can contact me on Instagram, the Celebrity Midwife. Thank
Okay.
you.
Thank you so much. So she's on Instagram, and also, are you on Facebook, or it's not
Yes.
the same name?
Lady Akua Afriyie on
Oh,
Facebook.
okay, so Celebrity Midwife on Instagram. Look for her, and then everything about your penis, especially about circumcision for both adults and babies, would be solved. Okay, so my name is Midwife Sally. Thank you for watching. Have a great day. Bye.